Hello, everyone, and welcome to phyloseminar.org. This is the third talk in a series of 3 talks on the intersection of phylogenetics and public health. Please use the YouTube live comment box to ask questions. Today's speaker is Arianna Miles-J. Arianna earned her MPH and PhD in epidemiology at the University of Washington, followed by a postdoc focused on the genomic epidemiology of healthcare-associated infections at the University of Michigan. Broadly speaking, Arianna is interested in expanding the implementation of genomic epidemiology within state and local public health through developing sustainable and flexible systems to analyze pathogen sequence data, as well as through teaching the current and future workforce about the power of genomic epidemiology to improve public health. Arianna is currently the Genomic Analysis Unit Manager at the Michigan Department of Health and Human Services Bureau of Laboratories, where she leads a team of bioinformaticians and genomic epidemiologists that process and analyze pathogen genomic data to support infectious disease prevention and response efforts in Michigan. Welcome, Arianna, and thank you for participating.
Thank you. Thanks, Eric, so much for the invitation, and I'm happy to be here today. I did see Ali Black's talk from last month and Henry's from the month prior, so I'm grateful to be able to be here to kind of round off this public health practice series. And my talk will definitely have some of the similar themes of the previous two, especially Ali's, kind of carrying forward this thread about this different focus of applying phylogenetics in public health practice, especially compared to more academic or research settings. And I'll expand more just on my perspective of how it's been used and how it's being used, some of the unique challenges and opportunities for this work, and kind of some of my hopes for the future. So this slide just kind of lays out that same thing. We'll start with how phylogenetics has been used in applied public health, then turn to challenges, and then talk about some of the just unique opportunities and places we might go with applying phylogenetics in public health. So I'll start with some applications of phylogenetics in public health practice. And when I think about the potential and the true power for phylogenetics and infectious diseases in public health, I think about how it can give us the deepest understanding of the evolution and spread of infectious diseases possible. And this tends to involve large, diverse data sets and more sophisticated analyses, at least from the perspective of where we're at in public health. So Bayesian time trees or phylogeography or other forms of ancestral state reconstruction or phylodynamics, probably the stuff that you all delve into more in this webinar, typically those types of methods. So I grabbed just a couple of examples here from the literature. On the left here, a bacterial example, looking at the global disease ecology of Salmonella enterica, a certain serovar of that. And then on the right, a viral example of characterizing global influenza circulation. And again, these types of analyses usually involve basically more statistics and modeling, and emphasize the evolutionary biology underlying phylogenetics, more than you would typically see in some of the more common applications of phylogenetics in public health practice today. So that's what I'm going to talk about next. So people working in public health, probably when they think of trees or phylogenetic trees, what they think about most commonly is these 3 buckets of applications, and probably really the first 2 the most. I would say the most common is definitely going to be outbreak detection or outbreak investigations. So these are the questions of do these 2 samples match genetically in a way that's consistent with plausible recent transmission? The second most common is probably going to be your situational awareness of circulating strains. So this became more to the forefront during the COVID-19 pandemic, with COVID variants and variants of concern, but has also been occurring with flu typing and flu subtyping. And of course, not all methods of classifying strains are phylogenetically based for all pathogens. So for bacterial pathogens, there's still some kind of more legacy methods like the 7-gene MLST that we use whole genome sequencing for. That's not strictly phylogenetic, whole genome sequencing, phylogenetic based. But there are other pathogens that have a more solid phylogenetic background to this typing aspect of things. And then the third is vaccine development. And this one we might not think about as much because the actual phylogenetics work for vaccine development happens at the federal level at the CDC, but I'll describe in a little bit how like state and local jurisdictions participate in the sample collection and data generation for those efforts. So I'm going to delve into each of these just a little bit more and provide just like a little bit more examples of some of the programs and ways they're applied in public health practice. Um, I can't really usually give talks about public health, pathogen genomics, or phylogenetics without mentioning the PulseNet program at CDC. And this is a national foodborne genomic surveillance program. And it's really where, like, the program that brought genomics and the concept of genomics and phylogenetics into public health, especially like state and local public health. It used to be by the name based off pulse field gel electrophoresis, but they transitioned to whole genome sequencing. I want to say it started somewhere around 2015 and ended up somewhere in like 2017 or so when they fully made that transition. And in this program, phylogenetics is used to detect foodborne outbreaks, but it's going to be kind of like a pretty basic form of tree building. I think often they'll use something called core genome MLST alleles and create kind of dendrograms based off of that. So not like really in depth or like fancy modeling or anything like that. Another application for outbreaks, public health often assists with outbreaks that might occur in congregate care settings like jails or nursing homes. So most of your work that public health will do that might be like more like viral outbreaks like COVID or flu or norovirus are going to be these congregate care settings, and phylogenetics can be used in those outbreak investigations to distinguish between multiple introductions into a particular facility versus plausible recent transmission. And then another kind of class of pathogens, antimicrobial resistant bacteria, and those outbreaks in healthcare. There's another program hosted at CDC called the Antimicrobial Resistance Laboratory Network. And there are laboratories, regional laboratories throughout the country that do characterization of these healthcare associated infections, certain types of them, certain drug resistant types of them that we're tracking more closely. And whole genome sequencing can be a part of that. And then following from that, phylogenetic analyses come from that as well. More actually in Michigan, we spend a lot of our resources in this area of pathogen in the genomics section to do outbreak detection and investigation for healthcare associated infections to support our healthcare associated infection epidemiologists at the state and then the facilities that they support. And this one is at this time, more like customized analyses are mostly happening at the state level, unlike the PulseNet program where all the analysis is actually happening centralized at the CDC level, which makes some sense because foodborne outbreaks are like so nationally distributed often, and regionally distributed healthcare infections can be as well, but are also like a little bit more localized. So just to give like a glimpse of some of the phylogenetic trees that might be used in these outbreak investigations and some tools that might be used in applied public health, um, there's something called the NCBI pathogen detection tool that has genomic data from bacterial pathogens that are associated predominantly with public health institutions submitting this data. So they take raw sequence data from SRA and process it and do cluster detection, and they use phylogenetic trees kind of in that platform. And this is a tool that's used for those foodborne outbreaks and healthcare associated infections, especially for epidemiologists or genomic epidemiologists that aren't making custom phylogenies or maybe don't have bioinformatics support in-house. They can still like see phylogenies and clustering using this tool. There's also more customized like in-house visualizations that happen, like in my group in Michigan, for generating reports for epidemiologists. So we'll often use things like R to generate phylogenetic trees for like static reports. And this is also a bacterial outbreak investigation example. And then there's also tools like NextStrain for which, the builds that are in NextStrain are more predominantly in the viral category, and a little bit more at that like genomic surveillance level than the like specific outbreak investigation, although the underlying tool of like OSPAs can be used to make all kinds of trees, and some people do use that for their outbreak investigations as well.
So Arianna, I mean, this is a pretty complicated thing to like take a bunch of bacterial sequences from the SRA and build a tree. So like, can you say a little bit more? I mean, are these like, is there a specific locus that's being there, or this whole genome, or like, how does this all work?
Yeah, I would have to. So I've seen Bill Klimke, who runs this program at NCBI, give talks about it several times, but I don't have the underlying methods fully memorized of what they use. I think they used to use like KSNP or something like that, and now these might be allele based. Now I don't remember for sure if they're allele-based or SNP-based. I know their methods are published somewhere. So if you Google NCBI pathogen detection and
Okay.
see what you could come up with, yeah. But yeah, no, it's no small task, and it's not all data from SRA. They, like I said, specifically are targeting like public health data. So things are submitted by health departments and CDC, but you can also submit your data to them and then have it like incorporated in. But yeah, it's pretty impressive what they've been able to do as far as like taking these public repositories and pouring the data into tools that make it more accessible to people. So
Cool.
yeah.
Thanks.
Okay, so shifting over to more applications in like surveillance and situational awareness. This again became like a little bit more in the forefront during the COVID pandemic. On the left here is a screenshot from the CDC's variant prevalence dashboard and forecasting that they do, which I know they're updating less frequently these days because there's not so much data anymore. But this really brought this idea of like situational awareness using phylogenetic based methods to classify lineages like really up to the forefront during the pandemic, and a lot more people became aware of this type of application of genomics and phylogenetics, although just by looking at this dashboard you might not know that phylogenetics are kind of the underpinning of these different variant classifications that are in here. Another example is Candida auris, which is a fungal pathogen healthcare associated infection that's of public health concern in the past 5 years or so here in the US. There's different clades of Candida auris. Um, this is an example of a pathogen that it is a phylogenetic basis to classify the clades. They're really genetically divergent clades that have emerged in different places in the world. So they're pretty easily distinguishable from each other. But phylogenetics is used to do that clade classification, and then you can see that the clades are in different proportions across the country. So there are like regional patterns as to like what the most prevalent clades are, depending on when and where the initial Candida auris strains were introduced into that region. So that's an example of kind of like how typing using a phylogenetic basis can be then like summarized and used in public health. And like I mentioned, not all typing or subtyping that's done is truly phylogenetic in nature. Like for bacterial pathogens, we still use whole genome sequencing to classify then serogroups or serotypes based off of like matching to sort of older immunological based characterization methods. But depending on the pathogen, like sometimes it's more of the predominant method. And in general, in public health, typing is a common application of genomics more broadly. And then this application in vaccine development, I think is really one of the oldest applications of phylogenetics in public health. Like I said, that work, like the analytical work, is occurring at the CDC, but state and health departments and local health departments and laboratories do help collect samples for this effort, this data collection effort, to inform vaccine development. It used to be that state public health labs would send just samples to CDC, and the CDC used to be the only ones that would do the sequencing and the analysis. And then slowly, as that technology became more accessible for sequencing, they kind of established these like regional laboratories, like one or two of them that might do sequencing and then just send the sequence data to the CDC. And they're kind of expanding that. There's more of like a democratization happening of the sequencing activities across the country as all public health laboratories really have the ability to do whole genome sequencing. So now we might more commonly also generate the sequence data and share that with CDC, although they do want a subset of strains for their kind of phenotypic characterizations as well. And then that data is used at CDC and with partners to build phylogenies to inform vaccine development and predict the strains that are going to be circulating, for instance, in the next season, like with flu, and they're constantly assessing things like that with COVID as well. And I think a more recent application that's just kind of getting off the ground more, you heard Henry's talk about RSV. So now since there's vaccines and monoclonal or antibodies for RSV, monitoring the impact of these public health interventions on kind of the natural history of RSV. That's the type of work that might occur at the CDC, but there's going to be states that are helping to generate and share that data. Okay, so hopefully that gives a little flavor of sort of the main applications of phylogenetics and public health that I see in my work, at least, or my experience so far working in public health. Next, I'm going to talk about some of the unique challenges and kind of quirks of working in public health practice and how it applies to implementing phylogenetics. So I try to categorize them into three main types of challenges in implementing phylogenetics in public health. The first is infrastructure and bandwidth limitations. The second is processing a continuous stream of data. And the third is sharing outputs and then the risk of misuse. So public health infrastructure broadly was not built for the genomics era or for phylogenetic analyses. And I'm referring here to both computational resources and infrastructure, as well as the workforce and the people that work in applied public health. So starting with computational infrastructure, I know you talked a little bit with Hallie about this last time, but in general, over the past decade or so, um, uh, getting over the IT challenges, just to do bioinformatics more broadly, including phylogenetics, is a big one and a big thing that people working in this field and applied public health have been working on. So when you work in an academic setting, I think, I did as well. And you can kind of take for granted the really awesome high powered computing cluster and things that you have at your fingertips and the people you have to support that to do the work you need to do for your research. Most public health agencies don't have that support, don't have support for Linux based systems or something like a cluster. We do have a small one in Michigan, but that's like the whole other thing. But cloud resources are available, right? So Allie talked about using that in Washington. However, cloud-based resources have their own challenges. It's kind of, there's more of an understanding of cloud-based resources now, but like 5 years ago, from a governmental perspective, they were very suspicious of the security of cloud-based computing. And even now, a lot of people that rely on cloud-based resources can't do analyses that involve public or PHI or PII, private health information, on those cloud-based resources, which can be a bummer sometimes for certain phylogenetic analyses. So this is definitely a barrier. In a related computational issue is just data storage and the structure of data storage, which is that genomic data and epidemiologic data are stored in separate systems. And depending on the jurisdiction, like which state it might be, the laboratory that might have most of the genomic data and the epidemiologist might be even in different agencies. And so sharing data across systems, either across agencies or within an agency, but across different kind of high level teams is a challenge. And also linking data down from like public repositories to like epidemiologic surveillance systems is another challenge. So a lot of time and effort is spent on this kind of data linkage issue in public health in order to enable the types of analyses we might want to do for phylogenetic analyses. And then the workforce. So, the workforce that's been working in public health for a long time is not going to be trained in executing or interpreting phylogenies because it's a newer thing to be applied to public health practice. Although there's starting to be more people with this experience working in public health, including in state public health, as evidenced by this seminar series. So if 10 years ago Eric was looking for people who worked in state public health to give a lecture on phylogenetics, he would have had a much harder time finding speakers. So folks like Henry and Ali and I that have transitioned from more academic roles into public health practice are kind of evidence of some of these workforce transitions that have happened and the subject matter expertise that has entered applied public health in phylogenetics and in genomics. And then I think the other speakers might have alluded to this too. There's just like a lot of competing priorities in public health, and I'll talk more about that when I talk about the data streams. But basically, just the bandwidth to address some of the more intellectually interesting questions or do the kind of interesting analyses that you might want to do with the data is just not there. People are busy addressing other things. Okay, so the continuous stream of data is both a blessing and a curse. And I think Ali talked about this a little bit in her talk as well, about the difference between in public health, like the data is like continuously flowing in. So there's challenges where it comes to phylogenetics as far as like what are we making trees with? Like Eric was just kind of alluding to, like it's not trivial to make giant trees with like data and SRA and things like that, but even just locally in one state, as we have been sequencing longer and longer, what are we including in our phylogenetic trees that we make? Are we taking an approach where we're kind of trying to break things down into smaller groups before doing any kind of phylogenetic builds or analyses? Or are we building trees and then like downsampling from there? Or are we using more advanced methods like phylogenetic placement that have come online during the pandemic era to like make these really big trees? So many people here are probably familiar with Usher. The bottom figure is actually, I saw a preprint recently from the Usher folks about using it for TB. So there's like this giant tuberculosis tree and the potential applications of using those methodologies for tuberculosis cluster detection and other uses there. So I would say that a lot of the work goes into the how of how do we continuously ingest, clean, and integrate data rather than like the analyses that we're kind of doing with it down the line. And then, like I mentioned with the vaccine development, a lot of times like our primary sort of goal that we need to accomplish is to get the data and to share it like with CDC as part of grants or contracts that we have. That's where we get funding from for a lot of these programs. So we're kind of just addressing these different process goals with our time and not always getting to some of the analyses that are more downstream. But yeah, and I'll talk about the upside of all this data in a little bit too. Okay, so I think this is a big one, the risks of sharing outputs and the risk of misuse. So one thing that's important to know, and I saw you heard Eric in my introduction say that I'm based at the Public Health Laboratory. Ali is based on the epidemiology side or part of public health. But in public health laboratories in particular, it's important to know that they are regulated environments. So they're usually accredited either by the College of American Pathologists CAP or the Clinical Laboratory Improvement Amendments, CLIA. These are the most common agencies. And this is like most relevant for clinical testing, which is one of the main functions of a public health laboratory. So if they're generating results and providing those results back to patients, they have to fit like certain criteria to keep people safe, basically. But if phylogenetic outputs are coming from the laboratory, this tends to fall more into what we call like a surveillance application. So it's like more for epidemiologic use rather than for direct patient care, but it still tends to need to fall under some of the same frameworks that these agencies put out for validating and assessing outputs. And leadership at the laboratory is going to have different standards for like what that means and what can be shared. And in general, people are pretty vigilant about causing accidental harm with results that come out of the laboratory or putting the laboratory's like accreditation at risk by having something misused or misinterpreted. So that's just something to keep in mind. That is something like just in practice and day to day, like when we're developing all of our sort of processes and paperwork and policies, it's to be in line with sort of this environment that we're operating under in the laboratory. And then sometimes phylogenetic outputs could come from epidemiologists who do most of the outward facing communication, but there's still going to be like more pause when sharing outputs or using data to inform policy or share things with the public in public health, because as a public health authority there's just a lot of responsibility and just like a little more liability and how things are used. And just you have to have an awareness, I think, of working in this field that there's like true like privacy and ethical concerns and considerations, including for programs that have been around for a long time that involve genomics. So I just wanted to highlight here um, an application of phylogenetics that I didn't talk about is an HIV genetic surveillance, which my group doesn't work on that in particular, but the CDC has been doing it for a long time. And given the sensitivity of that particular infection and the people that it affects and the legal implications in some jurisdictions of knowing your HIV status, it's been a really controversial program. And they've had to, it's still ongoing, or last I checked, I don't exactly know the status of it today, to be honest with you. It was more like late last year. But they've had to really kind of like rebrand it and rethink about how they're preventing things. I think they used to call it molecular surveillance, and now they call it cluster detection and reporting, just because I think that like surveillance word can really give pause to people. And so yeah, this is this whole other world that we need to think about of like how things might be received and what the impact of that is going to be on sort of the like reputation of the agency and in public health that we always have to consider in the work we're doing. So just some extra considerations there. Okay, so I will end today with a little bit more of a positive note and outlook, going past the challenges and focusing on sort of the progress and opportunities and strengths of applying phylogenetics in public health practice. So two kind of buckets of main strengths that I came up with. One, the same data availability or like big data issue that we're dealing with that can be a challenge is also a real strength. So, and often in public health, we are working with both genomic data availability and epidemiological data availability, which, as we know, kind of leads to the potential to ask sort of some of the richest questions that we can with phylogenetics. Um, so I'll talk a little bit more about sort of where this data availability like comes from in this section. And then just Ali mentioned this as well, like the potential for immediate impacts by being like positioned closest to sort of the most pressing issues and needs of our communities and our states or our country, to be able to like pivot our work to sort of address what is most needed, is definitely a rewarding thing. And I think in any type of technology or method or application, including phylogenetics, could have like sort of maximal power by being used when it's like that close to the need at hand. So when it comes to data availability, um, in case people aren't familiar with the public health kind of system, the epidemiological data, or like when you're a genomic data analyst, you might call it metadata, but to the epidemiologist, it's just the data, often come from something called case surveillance. And I feel like this is sort of sometimes an under mentioned aspect of things and when talking about public health genomics and the applications of it. Like we kind of talk about how we have the epi data, but don't talk about like what goes into getting it. And I'm not an expert in this area. I have colleagues that are, but certainly a whole like public health informatics is a whole rich field of its own. But really, at a high level, this process of case surveillance. So there are nationally notifiable diseases, including infectious diseases, and then at each state level or sometimes local level, you'll have reportable infections within that like smaller level of jurisdiction as well on top of the nationally notifiable and reportable ones. And the way that this happens is basically there's a health related diagnosis or event at a clinical laboratory often or at a local health department or something like that. um, this health related event is recognized by the reporting source, again, often like hospitals or sometimes local health departments. They then report this event to the responsible public health agency, which is, the flow goes typically from like, it would go from like a hospital to a local health jurisdiction to like the state. Then, depending on what the infection is, if it's reportable to CDC, it would go up to CDC. Um, and then like the necessary data is collected about that infection, which can involve certain information just directly from health records, which they're constantly trying to develop ways to better and quicker get that information in an electronic way. Um, or depending on the situation, it could involve some more hands-on, like contact tracing case investigations, they call them, that are often done by local health departments or sometimes with report from the state to actually call people, gather information about what their infection is and what's going on. And then this data is used to ultimately aid in control and prevention strategies and provide feedback to stakeholders, as well as to, like I said, where applicable, share to inform a more national picture. And sometimes this whole case surveillance process does involve sending specimens to public health laboratories for testing or additional characterization. So public health laboratories often serve as reference laboratories, meaning they're kind of like these gold standard at really being able to kind of confirm the characterization of something or a diagnosis. And then this sort of additional characterization can encompass whole genome sequencing as that has become more available at public health. And then genomic data is often generated from there. So the genomic data that's generated at the state public health lab often is piggybacking on this sort of whole case surveillance process. So that's how you end up with some of the epidemiologic data and the genomic data. Of course, public health labs aren't the only people generating genomic data. It's also being generated in research settings and academic settings, as well as like during the COVID-19 pandemic, there was more creative ways of generating more genomic data that like the CDC contracted with commercial laboratories to work with pharmacies to get specimens to generate data. So that's like a whole topic in and of itself, is like where and how do we get the specimens to generate genomic data for public health. But this is one pathway that exists right now that I wanted to mention as just kind of how it works and how we get to this data availability that we talked about. Okay, and then this potential for more immediate impacts being closer to the needs of our communities. And this is where it comes to like using, like Ali mentioned, using phylogenetics to shape like decision making or policy, and what are some of the things that might look like. It could be resource allocation, like vaccines, or sometimes working with like emergency preparedness on certain like treatment distribution in the jurisdiction for something that's going on. So both prevention efforts as well as response efforts to outbreaks. So phylogenetics, whether it's clarifying transmission hotspots or kind of refining things based off of subtyping and variant identification, can impact this concept of resource allocation in public health. Connected to that, genomics and phylogenetics can affect case definitions for like how we are treating a case in an outbreak, or how we are defining things like a case of a variant of concern, for instance, in COVID. So it can again help like refine things from a more like an outbreak response or surveillance perspective, but just kind of in this data summarization, not necessarily in the resource allocation piece of things. If we have a better understanding of where things are coming from or where they're spreading the most or how they're spreading or some of those key like epidemic dynamic parameters that can all feed into issuing guidance that might come during like an unusual big health event, again, like the pandemic or smaller, more contained situations like, well, Mpox is big, but like the kind of initial outbreaks was a smaller situation. So the information we glean from that can be fed into developing guidance. And then something like traveler's health is sort of just like a extension of that, um, kind of this better picture of where things are coming from or where things are circulating outside of the United States so that travelers can be aware of risks or vaccines that they need to get or monitoring themselves for any symptoms of certain infections when they get back, things like that. So these are ways that genomics and phylogenetics specifically can have more immediate impact in public health. Okay, so ending with some thoughts and reflections on the recent past and what we're doing now and some hopes for the future. So the pandemic definitely familiarized public health more with phylogenetics through tools like Pangolin, through things like Nextstream, and things like Usher. It brought some of these tools more to the forefront in public health, which there's whole things to discuss various pros and cons of like that model of some kind of like these sort of key public health tools being in these like academic settings and people not necessarily being recognized or compensated totally appropriately for all the work they're putting into these tools. So that's like a whole thing. But in general, it like made people more aware of phylogenetics definitely in public health practice that with things that used to be really squarely academic or something that might only exist like at the CDC. And the combination of bringing this awareness up through tools and then the increasing presence of more experts in public health takes the methods kind of out of the ivory tower. Again, it used to be, oh, this phylogenetics is something that only happens in academic research settings or with experts at the CDC. But I think this integration is happening and bringing more of this expertise into the state level is sort of breaking down this idea that there are people on high that are just studying things and then telling the people on the ground in public health like what to do with that information, but creating more avenues for true partnership in these methods. So I think like Ali is part of the Pathogen Genomics Center of Excellence in the Northwest. That's an example of like formalized efforts to create these academic and public health partnerships and to bring some of the methods and the findings from phylogenetics more directly into public health practice. So I think this has been definitely in process in the recent years. I think there's still a lot more work to do to make phylogenetics more accessible to sort of the current workforce and not just the subject matter experts that work in public health, but also the field epidemiologists and other people in the laboratory and leadership in public health. And that's like a big part of our work as well. And my work working in public health is to extend some of this like outreach and education and communication kind of within public health as well. So we've been really working hard to build the infrastructure components that some of them that I talked about to enable more robust, powerful, sophisticated genomics and phylogenetics in public health. And as we continue to build, hopefully things will become a little bit more accessible and a little bit easier. And we saw how needed these things were during the pandemic, and so hopefully the groundwork that we're laying will make everything a little bit more at our fingertips and more easily accessible in future situations, as well as just the ongoing genomic surveillance and ongoing work that we do to monitor things and respond to outbreaks as they occur. So when I think about the future um, and how phylogenetics might be more routinely leveraged in public health in the future, I think I kind of think of this like feedback loop between using the really rich data that is generated in public health to better refine and inform some of the methods that have been developed in the more of an academic setting. Um, and then ideally being able to bring some of those methods into public health in a more routine or real time way rather than a more retrospective way. So the key things I think of is just estimating the key measures of epidemic dynamics and things like reproductive numbers, and having that additional supplementation of the genomic informed measurement of these things, as well to support the sort of traditional epidemiologic case count way of things, really filling in gaps that we have in data collection when it just comes to case surveillance and public health. Similarly, um, some of the modeling of the global spread of pathogen infections, I think we're seeing this a little bit more in the viral world. I think in the bacteria world and certainly fungal, we're like much more flying blind on like things just seem to show up and then we deal with them. And we don't really have the best grasp on some of the underlying dynamics or patterns that are kind of leading to some of these emerging threats. So getting that a little bit more integrated for more of a variety of pathogens, I think would be great. And then these are all connected, but some of the like quicker identification of emerging threats or emerging variants. And again, not just the viral concerns about pandemic viruses and lineages, although that's obviously important, but also like there's, there are equivalents on the bacterial side of sort of emerging clones of like antibiotic resistant infections or various foodborne infections. And again, we have much less like visibility into that. And it's more of like once there's an outbreak, once there's a situation, then you're responding to it. So I think all of these things like fit with this general um, sort of hope for public health in the future to be like a little bit more resources towards the prevention and having to dedicate less times and resources to the response once things already happen, although there's always going to be both of those things in public health. That's kind of broadly how I see like the some of the future applications. And I think also um, in addition to phylogenetics, specifically just modeling generally and infectious disease modeling has become more ingrained into public health practice as well. So I think just these concepts of models, their limitations, what they can do for us, what they can't do for us. It's like integrating some of that knowledge more into the fabric of public health to be able to utilize it more powerfully and in real time. That's kind of what I see as part of the future. And I think, again, that the data that we have can help make those methods better. So ideally, that's where these partnerships come in. Okay, so I will end there. I wanted to thank funding sources from the CDC Office of Advanced Molecular Detection that supports our work in Michigan, my laboratory leadership, because without the leadership support for our program, we wouldn't be able to be doing the work that we do in genomics and applied public health practice. And then my counterparts, Heather Blankenship, she's the genomics technical director above me. She oversees the whole section. I just lead the team that does the dry lab part of the analysis. And then Becky Kramer leads the team that does the wet bench sequencing part of things. So with that, if there's any questions, Eric, I'd be happy to take them. But thanks again for the invitation. I was happy to be here today.
Great. Thank you so much. And I do hope people post questions. I do have a lot though, so that was a wonderful talk. Thank you. So it was interesting when you brought up risk of misuse. It seemed like the first thing you went to was privacy, and I totally see that. But are there other additional problems? I mean, when I think of risk of misuse these days, I'm thinking about, I don't know, people buy weapons and things like that. But does that sort of discussion also show up?
Yeah, I don't know. Maybe that fits into like, I mean, I think in the laboratory in general, right, there's like general concerns about how activities in laboratories or related like data could be misused. So yeah, I think that's like a slightly different direction that I wasn't thinking of, but I see how it fits for sure. I was thinking of like the privacy, and then just generally another thing that I probably didn't say very explicitly is just misinterpretation, because there's just so much nuance, and nuance doesn't translate very well often in headlines and in public health messaging. And so I think there's like this feeling that it's like, if it's so nuanced that you can't communicate it concisely, you can't communicate that uncertainty in a concise way, then you're just not going to even share it at all, because it risks doing more harm than good, basically. So that's like another been in addition to some of the privacy and ethical concerns I was thinking of. But I don't know, even like more intense misuse of data, I'm sure that there are things that I wasn't thinking of too.
Yeah, well, I don't know. I mean, if it's already out there, sharing the genomic sequence maybe is not so bad. I don't know. And so, to be clear, the vaccine development side of things is really about like tracking strains, tracking new strains. It's not like it's like vaccine choice as such. Like it's like figuring out which of the strains that we want to target with the vaccine.
Yeah. Yeah, I mean, that's my understanding. It's definitely not my area of expertise, but that's my kind of main understanding of it. But then I think I mentioned too, I think there is a little bit of this flip side too of the monitoring the evolutionary impact on these interventions, including vaccines that we have available. Like, has this pathogen then started to shift away and escape sort of these interventions that we are implementing and widely? And so I think that's not development, but like kind of almost like evaluation, and then feeds into like if we need to make changes in the future, for sure.
So I loved your idea of like we're building infrastructure, we're laying bricks and things like that. But I'm just actually curious, like how does information travel within these public health departments? I mean, they're statewide.
Yeah.
I'm sure there's like a statewide culture, but like, okay, Arianna does something awesome. She builds some new infrastructure that's like generally useful. How does that propagate to all these different state level labs?
Yeah. So when you say state level labs, do you mean like, so there's kind of like usually there's one big public health lab in a state, and then like in big cities, sometimes in California is like its own thing because it's like a country and they have labs that are big. But so yeah, when you say labs, you mean public health labs, or you mean like clinical laboratories,
Well,
like a
this is
hospital?
revealing my total lack of understanding of
That's
anything.
okay.
I mean, so you're at the Michigan Department of Public Health. I mean, I know there's also Washington Department of Public Health. I mean, we can
Yeah.
take those two as being sort of exemplars of like how does information travel between these labs? I mean, best practices and things like that.
Oh, even like across states.
Oh yeah.
Okay, sorry. When you said state, I was thinking within state. Yeah. It really doesn't very much. I mean, and then like getting data to the CDC is like a whole other thing. So uh, this is just how our public health system is. It tends to be more locally driven. There's like these things called like home rules, where like really local jurisdictions have like the say in what's going on in public health in their region, and then if it crosses into the state, then the state has jurisdiction, and then the CDC has jurisdiction if it like crosses multiple states. Um, so like data sharing, I would say genomic data is being shared through public repositories like NCBI. That's where we might see data from like Washington State, like, oh, what's this estimated factor that they have in Washington State? Is it similar to the one in Michigan? But the epidemiological data doesn't get shared outside of like the agency. So
I'm actually asking a simpler question, which is like, okay, so Arianna starts using Nextflow or SnakeMaker, and she builds this great pipeline that she thinks
okay.
other people should use. Like, how does that
Yeah.
infrastructure travel
Yeah.
in states?
Okay, so yeah, there's some examples. So there's like code. GitHub is used. It's something that we're still navigating in Michigan with getting the proper permissions and compliance. Washington's ahead of us on that, and so they can share their pipelines on GitHub, and CDC has pipelines on GitHub too. So I would say GitHub is the way to share code still. At least last I checked, that was sort of the most common in the academic settings. There's other things like position descriptions or like recruitment guides or things like that, and those are often mediated through, so there's kind of these two agencies, Association for Public Health Laboratories, that's like the professional network of laboratories, and the Council for State and Territorial Epidemiologists, like for EPIs. And so these professional organizations will often organize some of these more things like these like position descriptions and recruitment guides and best practices type stuff. And that might be a way that that type of information gets disseminated like across different states. As well as CDC hosts various kind of like communities of practice and things like that, where we can like communicate with our partners in different states to talk about some of these different things and potentially share policies and templates and stuff. So that is kind of through either like CDC organized communities of practice or like subcommittees, work groups, et cetera, through APHL or CSTE, I would say is like what brings us all to the table together most often to share what everybody's doing, how they've gone about it, that kind of thing.
It seems like it'd be really fun to have like a big Slack thing, like where all the people could just like.
There are a couple Slacks. There are. Duncan has organized a Slack during COVID called Spheres, and then there's a group called Staff B for state public health bioinformaticians that have a Slack. So
Nice.
yeah, I didn't mention that one. There is a Slack as well. So that's another way.
So I mean, you were talking about things that have worked and things that you want to see. And it seems like some of the promise of we built something for COVID and now it's getting generalized to other settings is happening. And I guess NextStrain definitely existed before COVID, but that's where it sort of took off. And so now they're doing bacterial tracking, right?
I think at least a little bit. Definitely TB. I feel like usually people start with TB because it's a little more normal it's genome. But yeah.
So I mean, can you just drill down and just be a little bit more specific about the sorts of resources you would want to see? I mean, would it be just sort of like something NextStrain like you're talking about being able to do like modeling of global spread or like learning about global spread of lots of other pathogens? Would it be something like NextStrain, but just a lot more of it?
Yeah, I think so. Yeah, where it comes to tool building that's available for people to use more widely. I think things like, yeah, that model of something like NextStrain, but then it's like you have to have in order to make that really possible, you still have to have like some level of local accessible infrastructure computationally to run things, especially to run things with data that you can't upload publicly for like privacy reasons and things like that. So like you need to have the tools available, you need to have like the infrastructure available to run said tools, you need to have the people available that can understand how to run the tools and how to interpret things that come out of the tools. And then to be able to bridge that gap of the interpretation and presentation of data and results and communication of uncertainty and stuff like that. So I think it still fits in the like infrastructure is people, it's computational, and then it's, I think, yeah, like the software and like the tools, and then the underlying, of course, like methods and algorithms and statistics, which you spend more time on, is also vitally important, right? The things that they do what you think they're going to do and they perform pretty well. So all of those things are needed, but I think the biggest gap that's still on the public health practice side is just like working on some of those accessibility issues, which comes down to like the people and the computational infrastructure a lot of times.
Well, and also, yeah, I mean, I think academics do work hard to make their packages easy to use, but I'm sure like continuing to focus on that and making it something that people like a pit of success. Like it's like hard to use this package badly.
Yeah, I've seen that with NextStrain, just to connect all these things together. Like I've seen that on the Spheres Slack, right, where NextStrain developers are on the Slack and they're getting feedback actively from people that are using their tool in public health. And so that's the kind of thing that when you have those partnerships really established in those integrated spaces for people to communicate, it's going to be more efficient than when it's like some people over here and some people over there, and they have different worlds, different incentives. They're not talking to each other, even though everybody wants to do the best thing, like bringing them together. So, like, that's where it is helpful when you have people like myself in the Valley that have spent some time in both of those spaces that you can kind of then see things from multiple perspectives and try to figure out. That's like another form of that infrastructure, like the partnerships aspect of things. How do we establish these partnerships to get information shared more efficiently?
Cool. I guess I have just one more question, and you can interpret this in any way you wish, but I mean, this is a bit of a fraught time for public health in the United States, and I just want to know, like, is there anything that we, as citizens and also just as scientists, can do to support public health?
I mean, obviously, there's always voting. That's always an important thing. I think one thing that, and I'm honestly not, so I've only been in public health for 4 years now, which still feels like I'm kind of starting out. There's a lot to learn about it just as a system. And I'm also working as a contractor right now, but there are different, government employees have different rules about being able to participate in any advocacy. So even though there's like funding cuts happening, people that are working in public health are not necessarily able to like advocate for themselves to their governments for more funding. So then they rely on people that are not working in the government, whether it be hospital associations or like other professional associations, or I think like academic partners as well could fall into that of being like, hey, here's all the impacts of the funding cuts. Here's what public health is doing that is being lost. So I think there's room there for some of that like advocacy that people that work in the government can't do for themselves, but that requires having those channels to get that information to communicate out. But then, yeah, if you know people that work in public health, check on them and offer your support. Like the morale is definitely really in a challenging place right now. So there's just those personal connections, but those are a few things that come to mind.
Okay. Well, great. Well, awesome. That was a great way to complete our theme on phylogenetics and public health. I really appreciate your talk.
Awesome. Thanks again for the invitation.